Hello, friends. Good evening. Good Sunday evening, rather. So, here I am, Coach Reyes, Runners 360. And as we know, and as we've already told you, Sunday, 4 p.m. today, going live with Somya, sir. Just give me like a couple of minutes. Just going to get him online. Right. Hello, sir. Good evening. How are you?
Hi, Sheth. Good evening. I'm doing fine. Thank you. How are you?
I'm good. Am I audible?
Yes, you are. Am I?
Very much, very much. Great. Let's just give it a minute time, sir. I think we're getting some good response of people joining in live. We will start in probably like another 20, 30 seconds. And yeah, we will just go online on time. How is the Sunday going, sir? Sunday, easy
Good.
day?
Good.
No?
Parents are with me, and I'm
Friends are
really
with you.
blessed
Nice.
to have
Yeah.
them with me. And we went to
The
church
morning,
in
did
the
you go to your
morning.
church? Went to the church
Yes.
in the morning?
Yes,
Yeah.
I did. I did. And
Not easy. Saturday you work all day. Sunday morning you have to go attend, church, family, and then in no time it's already Monday tomorrow.
I mean, we all balance everything, right?
Yeah,
Family responsibilities.
yeah. Great. All right, I think it's 4 o'clock. I think let's go live. Hello, friends. Good evening. This is me, Coach Reyes. I don't want to say much about me, and today we have Somya Rout, sir, founder of Stairs Physio and Fitness, one of the leading performing. Athlete center, not only in Bangalore, also in India. A lot of people in Bangalore train with Somya sir and the team across 3 to 4 centers that they have in Bangalore. And also, I know many people outside Bangalore also, sir, would want to love and come train with you. And I've been associated with Coach Somya sir for the last 8, 9 years, and I've learned a lot at first hand. And in fact, I keep telling a lot of our friends that, it'll be great that, as a coach and as an athlete, who's been running for almost 17, 18 years and been training under a coach for the last 9 to 10 years, it's my, how do I put it across? It's my honest feeling that, we should be able to transmute our learning both to theory and practical experiences to many more people because there's a lot of stuff that's happening around. So I think in today's world there's even more a higher need for experts to come and pitch in and demystify many things that's happening in the fitness and the running and the sports sphere. So I mean, of course, this is one small little step. I'm sure that over a period of time we'll have many more steps. But just to start with, for example, I'll just say the context, sir. If you have like a minute or two. So in 2014 or 15, I had this IT band. The pain was, going 2013. I remember. I think I was supposed to run midnight marathon, and there was IT band. So I just could not run. It was on the left side, and there was a sharp shooting pain on my left knee. And then the only thing that we were told about is okay, roll your IT band, stand up, stretch. You know the typical IT band stretches.
Yeah.
But it took like 3 to 4 months to resolve. So at that point of time, nobody spoke about what is IT band, why is it happening, what is the root cause of it, and how to prevent it. And then after that, I had to go through a series of dry needling and all of the protocols for about 2 to 3 months. I was off running, and then I think, sir, I think around 2020, I felt something very similar. Okay, when I was working with you, and you said that don't go foam roll that and don't irritate that. You just hit something called as TFL. I don't know how to engage that muscle. So I think after that, when you hit that muscle, the TFL somewhere near the hip and the glute, all right, I could feel the pain right on my knee, and I was like shocked. So after that, it was just like gone, and there was nothing else. And after that, touch wood, God's grace, I think whenever a pain comes there, I know what is the root cause of it. So before going into that, sir, can you just explain, what is IT band, and why does it happen to runners?
First of all, thank you so much, Sheth, for having me. It's always good speaking to you and the initiative that you have taken. I feel that every sport needs education, better awareness for longevity. Obviously, at an amateur level, there's so much of work that we put in, day out to get better, to get stronger as athletes. But what happens is we need to understand that marathon running is a high impact sport. There are every day we put in a lot of repetitive forces, and the plane is always in one plane. When you run in one plane, so there is you do not move, run laterally, and then again there's a lot of rotational component coming into picture. It's always unidirectional, and
Mm.
in this plane, uh, what happens is biomechanically, since we are designed differently, we stand differently, we represent ourselves differently, we even when it comes to movement, we spot differently. Our mobility, our stability, our strength, everything is very different. So when you mentioned about having this discussion today, you very specifically mentioned about two things, QL and TFL, right?
Yeah. Yeah.
So what happens is basically in running, we need a better pelvic control. It's very important to have a better pelvic and hip control, trunk control, which these two muscles provide. Both these muscles originate from the iliac crest. Okay.
Mhm.
And if you see amateur runners and elite runners running, the hips are very stable. Elite runners,
Mm.
it's more of a kind of cyclical motion.
Yeah.
And amateur runners, we have a lot of hip drop and pelvis stress when we run. And the correlation between TFL and the QL is all about providing stability to the hip and the
Yep,
pelvis.
interesting. So before that, can you explain what is QL in full form
Yes,
and TFL in
yes.
full form? Yeah.
See, QL is quadratus lumborum. Uh, uh, so basically, we have pelvis. QL helps to provide stability in the upper part, upper quadrant, and the TFL provides stability in the lower quadrant. Now, interestingly, the glutes maximus, TFL, continuation of the fascia, which we call it as a iliotibial band, IT band, and the
Band.
insertion to the lateral part of the knee, which we call it as the girdis tubercle or the lateral part of the tibia. When we say I'm having pain in the outside part of the knee or the lateral part of the
Yeah.
knee.
Yeah. Yeah.
So, biomechanically, whenever, see, if you consider the name TFL, is the
Mm-hmm.
tensor fascia
Tensor.
lata. Okay. So
Yeah.
basically, the idea is the role of that muscle is to provide tension. That is the reason
Oh,
why the
interesting.
name, you know,
Okay.
to
Mm.
provide tension to the ITB.
Okay.
And
Okay.
these repetitive forces, when we run, causes more tension, and hence towards the lateral part of the knee, there is continuous friction and irritation,
Mm-hmm.
causing inflammation and pain.
Okay. Okay.
Okay.
All right.
Now, the idea is fascia, since ITB is a very strong band, very, very strong band, and rolling would not do any kind of justice in terms of releasing tension. And again, we need to understand there are two things. One is symptomatic treatment, the other is treating the cause. And
Mm-hmm.
TFL is a muscle. And remember, from TFL, the fascia continues and attaches to the outside part of the knee.
Of the knee. Okay.
That
Mm-hmm.
is where you need to release the TFL because it's been under repetitive load. You can use a ball, release ball to pinpoint
Mm-hmm.
exactly hit that area and
Mm-hmm.
strengthen the gluteals as much as possible. That's the only solution. And
Mm-hmm.
when we talk about strengthening the glutes, it has to be combined with QL stability and strength, which
Mm-hmm.
what we call, when we work on the glutes medius, we speak
Yeah.
about doing a side plank.
Correct. Yeah.
Okay,
Okay. Yeah.
doing a side plank, usage of bands, single leg standing, abduction, which is
Yeah.
taking the leg away from the body, you know, with
Yeah.
using a resistance band or using a loop band. So all these exercises help you slowly get rid of the IT band strain. And it's also
Okay.
very important to understand, is it the strength or the overload? When the mileage keeps increasing, when the
Increasing, yeah,
load
exactly.
keeps
As I was going to come
increasing,
back. Yeah,
since the
yeah.
role of the muscle TFL is to always be under tension,
Mm,
we
mm,
just we at times when we release the TFL, the stress on the entire fascia reduces immediately.
mm.
So that's where the first step is to release it and then
Yes,
add
yes.
strength to the gluteal complex and the QL complex so that the pelvis control is more stable.
Okay. So I have a question, sir. I mean, I'm just see everything I speak is from real life experience. So
Yeah,
on Thursday, when I came, one of the reasons why I said, sir, you need to work on my glutes is because I was ramping up my mileage. I still have the fear of IT band, which I've had it
yeah,
twice.
yeah,
But when I said that release my glutes and just do that, mobility, you always start anything around the hip, you always start with QL.
yeah.
I've always seen you first start with releasing the QL and then you go to the TFL and then you work on the hips. So can you just throw more light about what is QL, what is its role, and then why is QL so important that you always work on that first on both sides?
As I mentioned, as runners, the important see the QL. As I mentioned, it originates from the iliac crest, and
So
it
iliac
goes.
crest, can you just if you can just say that what does it mean? Iliac
Iliac
crest.
crest is the if you know the ilium of the pelvis. So we have ilium, ischium, and pubis. Okay, so
Okay.
there is a wing kind of structure around the pelvis, right?
Okay.
So it attaches from the crest. So that's why you call it as the iliac crest. Okay, from there it goes up. From there it goes up towards the lumbar region, which is the lower lumbar spine, L1, L2, L3, L4. All the
Okay.
transverse processes are the wings that we have.
Ha.
So what happens most of the time as runners, we start developing stress not only around the pelvis, but also around the spine
Okay.
because of the QL being always, working, providing you that support. So it tends to get very irritated and tight. Because as I
Mm-hmm.
mentioned, the role is to provide that stability. They're holding always.
Mm-hmm.
S- So I have to mobilize the lumbar spine.
Ah, okay.
First, I always mobilize the lumbar spine. When you lie
Mm-hmm.
down on your belly, I mobilize it.
Mm-hmm.
And then I try to, apply gentle pressure to release tension around the quadratus lumborum muscle,
Mm-hmm.
mobilize the joint,
Mm-hmm.
and then work on the glutes to improve
Mm-hmm.
the hip mobility. And
Good
as we do
detail.
with internal rotation, external rotation of the hip, I try to release the glutes.
Okay. So what you're saying is, we never have to see things in isolation, right?
No,
You always have to look at when you
the
diagnose,
kinetic chain.
let's say, the
Correct.
kinetic chain.
Yeah.
So now speaking about kinetic chain, see, because a lot of people that we're seeing are layman people, generally, they're runners and then they do. Can you just explain the role of kinetic chain, how the entire body is connected and why every aches and pain is interrelated to how the body is?
Right. I always tell runners that we need to have two kinds of screening. One is uh, functional testing. The other is a runnability test. Runnability is your ability to run. So, based on the research journal articles, there are certain uh, tests that we need to do to determine whether we are ready to run longer distance. When
Okay.
it comes to functional testing, the number one is overhead squat. Now,
Mm-hmm.
what is overhead squat? It determines the mobility of your ankle joint, the mobility of your hip joint with
Yeah.
respect to your pelvis. And obviously, upper body plays a very important role when you run. Your trunk,
Mm-hmm.
your the way you position your upper body with respect to your
Mm-hmm.
neck. And many people complain of neck pain after running,
A lot of people,
right?
oh yeah, neck
A
pain
lot
and
of
the upper
people.
back pain. Yeah,
Yeah, yeah,
lot very
oh,
common.
yeah.
Yeah.
So what happens is this overhead squat determines the amount of mobility you have across all the joints.
Mm.
Okay. For example, dorsiflexion, range of motion of the ankle, is an important determinant to a lot of injuries. If you do not have a dorsiflexion of 12 to 15 centimeter, then
10 centimeter. Okay.
which is
So what is
when we
the?
do,
If you can show in your palm, what is
yeah.
dorsiflexion and plantarflexion?
So if this is the ankle, okay.
Mm-hmm.
So whenever the ankle goes up is dorsiflexion.
Okay.
Whenever the ankle goes down is plantar
Okay.
flexion.
So you're
So
saying
what
it's 15
we are,
degrees.
yeah. So no, not this. So when we do
Okay.
the knee to lunge wall test,
Uh,
so we stand, we push the knee towards the wall. That
Correct.
dorsiflexion range has to be 15
15.
centimeter.
Okay.
So
Centimeter. Okay.
yeah,
Okay.
yeah,
Centimeter.
yeah, from the wall. So if you are able to do that, you hit the benchmark.
Hmm. 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 Hmm.
So the other is a great toe extension. So you
Hmm.
need to have good great toe extension of the if this is your toe, you're placing your toe, you should be
Hmm.
able to only raise your great toe and it should go up
Okay. Hmm.
to at
Hmm.
least 45 to 60 degrees.
6 degrees. Wow. Okay.
Yeah. So these are
Yeah.
all determinants, or we can say that if you do not have these, you can end up having a lot of stress in the chain overall.
The chain overall. Okay.
S- A lot of strain around the foot, shin, and the second test that we ask all runners to do is single leg squat.
Single leg
Is
squat.
so like for example, sitting to standing on a box. Now, what do we
Hmm.
check here? Is the position of the knee with respect to hip and the foot.
Oh. Okay. Okay.
So most of the time, what happens? The knee keeps collapsing medially, inward.
Hmm. Hmm. Hmm.
So I'll just show it to you. What happens is, if you can see me,
Yes, sir, I can. I can.
sorry,
Yeah.
I'm at home. So
That's fine. It's all right, sir.
when you stand here,
Yeah. Yeah.
sorry,
Yeah. Yeah. This is a good position. Yeah. Little
yeah,
more lower.
this is okay.
Yeah. That's fine. Yeah. I can see your knee.
Okay.
Yeah.
So when you are here, what happens is the knee, when you stand, the knee keeps going inside.
Yeah. Yeah. Yeah.
Okay,
Yeah. Yeah.
why does it go inside? Because of lack
Okay.
of gluteal control, to push the
Mm-hmm.
knee out. So that's
Mm-hmm.
where the TFL is trying
Okay.
its best to pull and apply the tension.
Oh. Okay.
But
Okay.
because of the biomechanical imbalance, the
Mm-hmm.
stress keeps increasing.
Mm-hmm.
So
Interesting. Okay.
this is the reason why the IT band is always stressed. So
Mm-hmm.
when we exercise, we need to ensure that your glutes medius is stronger
Mm-hmm.
so that the TFL is supported. We can't rely only on the TFL. It's a small muscle,
Okay. The TFL. Yeah. Very small muscle. Yeah.
very, very small muscle.
Yeah. And generally, sir. Now, for example, now let's say TFL is a very tricky muscle. Sometimes very difficult to
Yes.
place it. And I've realized, sorry, if I can take another minute, I've realized that when if you irritate that, I start feeling pain in my adductor and all that. That's one of the
Yes,
reasons
yes.
why I don't know how should I roll it. There are times when I place the ball around the TFL, I feel the pain inside my adductor. I know if I irritate that next morning, I start getting different pains. Now, how to find TFL for a just say like a layman person? How does he release his TFL and how much of pressure you need to put so that it doesn't get irritated? I remember you saying that TFL should not be irritated.
Yeah.
And what is that fine point?
See, basically, when you release it for 30 to 48 seconds. Okay.
Mm-hmm.
You just need to lie down. Basically, I always tell everybody that, the pant, that pocket area
Mm,
is
the
where
pocket.
you'll
Uh-huh.
find the TFL.
Okay.
Okay. So you need to just place the ball there and
Mm-hmm.
lie down sideways
Mm-hmm.
and focus on your breathing. So every time the ball hits the trigger point,
Mm-hmm. Mm-hmm.
the pain goes down the leg till the knee. That
Till the knee. Yeah. Yeah. Yeah.
because that's the trigger point.
That's the trigger point. Yeah. Yeah.
Yeah, yeah.
Can we can
You
can
just
we
need to
display
stay
that?
there.
I'll just get the ball. Can you guide me so that we can show people how to
Yes, yes,
release, how to find
absolutely,
the.
absolutely,
Yeah.
absolutely.
Just a minute. Yeah. You keep speaking, sir. I'm just finding the ball.
Yeah. So basically, when you lie down, the pain would be really intense.
Okay.
But then as you start breathing, after 30 seconds, the pain
Mm-hmm.
would almost disappear.
Okay. Now, for
That,
example, now let's say, I want to release my TFL.
yeah.
Okay. So now, all you need a foam roller or a ball. What's the best thing to do?
We need a release ball.
This is good. This
Yes, absolutely, absolutely. This is good enough.
a very 25 rupees you'll get. Okay. Now I
Yes.
want to do TFL. How would I do it?
So what you do is, can you have a side view? Can you
Oh,
just turn?
I
I
think.
just want you to turn the other side. No, no, you to turn the other
Oh,
side
me. Okay, okay. Sorry,
so that I
sorry.
can see your hip.
Oh,
Yeah.
okay.
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 Yeah. Everybody see the angulation that you first make. Okay, between your upper body and the lower body, closer to the hip joint, the
Mm-hmm.
pocket area. Just place the ball there.
Here's my pocket.
Yes,
Okay, press the ball.
yes, yes. There. Yeah, and just lie down sideways on the ball.
Okay. And how do I lie
Yeah,
down? Fully.
fully, completely. Just lie down. Lie down. Ensure that when you lie down, your arm is also down on the floor. Yes,
Okay.
instead of being on your elbow. Lie down
Okay.
completely.
And bend the
Yeah,
knees.
yeah. So you just lie down. Yeah. So as you place the ball there and move, you'll find a trigger point.
Uh-huh. Yeah.
Yeah, closer to the pocket region. Yeah, there.
Yes. Ah,
Yeah,
yeah.
yeah. And there, just focus on your breathing. Try to relax. Don't do anything. Don't move your body. Just focus on
Okay.
your breathing.
Ah, I feel it in my groin. It's normal.
Yeah, yeah. I mean, because that's a referred pain.
See here. Yeah.
Because
I
of the
can feel
yeah,
it in my
because of the
groin.
tightness, you
Uh-huh.
would feel all these area getting involved.
Okay. Ah, yeah. I can. Yeah.
Yeah. And the pain would also go down the leg.
Yeah. Now I can feel I can feel
Yeah.
right on the knee joint into the
Yes.
lateral quads.
Yeah. So that is where you are right there, you know, on the trigger point.
So no need to roll or anything. Just
No,
stay there.
nothing,
That's it.
nothing. You do not need to do anything. Just your body weight is enough. See, as the time goes by, the tension also starts coming down.
Yeah. Oh, sir, I go a little low. I can feel it right around the knee joint.
Yeah,
On the
yeah, that's the spot.
Okay, so you're saying you have to hold this for how many seconds? 45
30
seconds.
to 30 to 45 seconds enough.
Okay. And uh, and how often you need to do this, sir?
See, basically, you don't do it unless you feel it tight. Okay.
Okay.
The idea is again to keep strengthening the glutes medius, okay, which is side lying leg raise or single leg standing. You do the abduction
Yeah.
movement.
Mm-hmm.
Prioritize those movements rather than
Mm-hmm.
focusing on only releasing the TFL.
Okay. Okay. All right. So you're saying you have to treat it very, very holistically.
Yes. So,
Okay.
so as I say that you have to always work towards the cause rather
Mm-hmm.
than treating only the symptom.
Only a
Okay.
symptom. Yeah. Yeah.
Yeah.
So and now, for example, now let's say if somebody has an okay, very dicey question. As a coach, people come and say, have a pain around the outer knee. See, I'm not an expert. I'm a running coach where I give running training plans. And then based on my experience, I say, okay, this could be that. How do you diagnose a TFL? What's the difference between, let's say, when somebody says pain outside the knee?
Yeah.
Okay. For me, probably I'll be very candid and honest. Okay. There's only some permutation combination. You only speak from experience rather than science, unless you know the person. So we don't know, is it a PFPS or is it an IT band or is it, some ligament strain or is it a meniscus? How do you get to the right diagnosis? Because sometimes wrong diagnosis has damaged people to a large extent.
Yeah, correct. So when it comes to posterolateral corner of the knee or the lateral knee, a
The
lot of
outside knee, you mean?
structures, yeah, outside knee, there's a lot of structures are present, quite complex. For example, the biceps femoris, the hamstring muscle, the tendon also inserts there. Okay,
Mm-hmm.
the lateral collateral ligament of the knee is also there. Okay,
Mm-hmm.
the IT band insertion, the major part of the lateral knee.
Mm-hmm.
Okay, so what happens is we if when it comes to ITB, generally 20-degree to 30-degree of knee flexion would cause pain and irritation.
Oh, okay. Okay.
Okay, when the body is warmed
The
up,
knee flexion
people
means just to bend the knee,
bend
20%
the
will
knee
feel
to
the pain.
20 to 30 degrees. Yeah,
Okay.
standing, knee bending, going downstairs,
Ah, okay.
all rather than going upstairs. Okay, going downstairs,
Going
all
downstairs.
yeah, you'll have start experiencing pain in the outer part of the knee.
Mm-hmm.
So. Uh, when you start running, when the body is slightly warmed up, you'll not feel the pain.
Yeah, yeah, you'll not feel the pain.
And
Yeah,
after 8 9 kilometers, once the
exactly. Yeah.
and then the and
Classic
slowly the
symptom.
yes, and it's a stabbing kind of pain.
Yeah, yeah,
So
yeah.
this is where you continue to run, and when the pain becomes very high, uh, walking also gets very difficult.
Does IT band create some swelling also if it's too chronic around the knee?
Yes,
Or
it
does
does. Yes, it
it
does.
naturally do?
Yeah,
I
it
see some
does.
people have a little bit of a swell,
Yeah,
a
yeah,
small swell,
yeah,
around the
yeah,
lateral knee.
yeah.
Yeah. So you're saying IT band starts from TFL and then joins to the
Yeah, from the from glutes,
from glutes. Okay.
starts from the glutes maximus, then the
Mhm.
TFL is formed, the muscle. TFL, the fascia goes down completely to the knee.
Mm-hmm.
So if
So
you
now, go ahead.
Google or try to find out about TFL, origin you'll find, but the insertion is through the ITB and to the knee.
To the knee. Okay.
Yeah.
Yeah.
That is why I say no point working on the fascia. Work on the muscle.
Work on the muscle. Okay.
TFL.
TFL. Yeah. Um. Also, sir, for example, like, see, science is evolving a lot.
Yes.
Right. Now, when I first time I got IT band, we were stretching. This was 2013.
Yeah.
So second time I got IT band, we were doing dry needling.
Mhm.
Okay. That's good. After that, I just got one little hint and then you helped me there. Okay. And the question is, of course, because I've had three instances and the treatments have been very, very different. And of course, the root cause is what I've learned. Now, when somebody gets an IT band, what is the recovery protocol? Is it stretching, dry needling, or foam rolling, or passive rest, or
It's a, ve-
active recovery?
yeah, it's a very good question. Cheers. First of all, we need to understand why I have this ITB pain on the right side and not on the left side.
Ah, that's a good question.
So okay, number one. Second is, now if I have pain, what is the intensity of pain? What are the movements that causes pain? Is it very high, right? So pain management becomes an important criteria here.
Mhm, mhm,
So that is the reason why physios opt for dry needling and some kind of release, fascia release. But at the end, it's very temporary. You might feel good for 2 hours or 3 hours, but again, the main cause remains. So it's
mhm,
the important part right here is, instead of taking passive rest, which is a complete rest, you need to be under active rest. Okay,
mhm,
you need to still work on your cardio. You need to still work on strength,
mhm,
decrease your overall mileage and load,
mhm,
and slowly get better. So basically, in
mhm.
4 to 6 weeks, you should be back to sport.
Full-fledged training.
Yeah, because when the pain is acute, nobody actually gets it treated.
Yeah, yeah.
After 2 months or 3 months of suffering, when the pain becomes very high,
Mm-hmm.
then we take action.
Mm-hmm.
That's
Mm-hmm.
where it takes 6 weeks to get back to sport.
Get back to sport. Okay. Um, no, I think that's very, very important. I think training is very key. So now, just going back to one thing that you said, like for example, generally when you have IT band, right, the pain starts popping around 8 to 9 kilometers. Now let's say as a coach, when someone says, "Hey, I have IT band syndrome, but I'm not getting any pain till 8. After 9, I'm getting a pain." Now, should I tell that person, okay, to run till 8, but then stop after 8? Is it
Yes,
okay?
absolutely, absolutely. Go slow.
Okay.
First thing is run slow. Don't focus on speed. Don't try hill repeats or do some tempo interval runs. Run easy, slow, and
Okay.
focus on these parameters.
Mm-hmm.
And you would see, as you follow the routine, you'll
Mm-hmm.
start getting better. The problem is when we do not respect what is happening to the body, and
Mm-hmm.
we, you know, are very strict in following the routine.
Mm-hmm.
We need to understand that as amateurs, we have so many other, responsibilities, work, our sleep gets disturbed. Why do we run? The joy of running always gets hampered.
Mm-hmm.
Like I was talking to you about being passionate and harmonious runners
Exactly. Yeah.
always. So we need to again look back. To at all these parameters, speak to the coach. Coach would understand you can run 5 to 6 kilometers, slow, easy. Do not experiment. Trust the coach. Understand what he's trying to say, and follow a routine where the gluteal strengthening becomes an integral part. When it comes to running, single leg loading becomes an integral part rather than doing only squats. Stability plays an important role when it comes to running, marathon running as a sport. Remember, when we speak about runnability, your grade 2 extension, your dorsiflexion, your hip muscle endurance, your calf muscle endurance, and your quad endurance plays a very, very important role. So that is the reason why you have to include hip abduction exercises almost every session.
Every session.
I'm not talking about clamshell. I'm talking about hip
Yeah,
abduction. Okay.
just going there
No, it's good
because
to start. Clamshell
it's the
is
only IT band exercise people know is clamshell.
I mean, there's a lot more because we want to specifically target glutes medius. So little bit of extension of the hip, little bit of internal rotation, and then abduction would cause a lot of efficiency in terms of getting better and stronger.
Okay.
Especially when you load, you develop more resilience basically.
True.
So what I want to say is rest is not the solution. Optimal loading is the key.
Is the
How
key.
much load is enough is optimal loading.
Mm-hmm. And sir, another question. Generally when somebody gets injured, right, the first protocol is stretch. They say stretch your IT band, stretch your IT band. So what is your take on stretching? How much do you believe in the concept of stretching? Because I stopped after meeting you. I've stopped the concept of stretching. I'm even scared to bend forward and stretch. So what you taught me is range of motion. Like you just go to a place where, like, I never seen you force anyone into a stretch. Now, since I met you, I have never allowed anybody to touch my body to even stretch. I said, boss, do not force stretch. Okay. Now, when it comes to IT band, a lot of recommendations like you go to YouTube. The first thing is IT band you hit, you see stretches for IT band.
Yeah.
Okay. Can IT band be stretched, or is the right way to start, or should we foam roll, or should we do rehab? Can you just set the
Yeah,
protocol? Now somebody comes with you in IT band.
absolutely.
Can you just set the protocol for this?
Yeah. The first and foremost is, we need to understand what is the protective mechanism of the body. That is stress, that is tension of the TFL. I would suggest to work on the hip mobility first.
Mm-hmm.
Okay. Which we generally do using a power band because hip is a very
Band.
strong joint. Work on the mobility of the hip, number one.
Mm-hmm.
Second should be you can target the TFL when the pain is very acute. You can target the TFL, lie down sideways the way you did,
Mm-hmm.
and just 30 to 45 seconds, you just lie down. You would
Just
you
once,
would
once is good enough. No, don't
you
have to do
would
thrice a
no
day.
no don't keep repeating again and again. That's where it becomes very sore and irritable.
Mm-hmm.
So just once when we do it for 30 to 45 seconds, that would reduce a lot of tension or pain around the insertion of the which is the outer part of the knee. Once that is done, we need to slowly get into exercises. Which
Mm-hmm.
all when I say exercise, we need to start with isometric exercise. Now, what is isometric? Wear the band above the knee or around the ankle. Lie down sideways. Ensure that the hip, knee, and foot is straight, all in one line. Raise the
Oh.
leg up and hold. Okay. Lie down
Mm-hmm.
sideways, raise your leg up and hold. You'll start feeling burn around the gluteal muscle.
Little muscle,
Now,
yeah.
yeah. So the isometric exercises are also known as painkillers. You know,
Yeah.
so that would reduce a lot of tension around the outer part of the knee. When the pain comes down, you'll become more confident.
Correct. Correct.
With glutes, you need to also strengthen your hamstring, your quads,
Mm-hmm.
your calf, basically the chain. When I talk about the chain, understand why is your right side taking more load as compared to the left side. Try to work on in those lines and slowly return to sport progressively. First walk, see if you're pain free, walk and jog, stair climbing, going downstairs, pain free, especially going downstairs. And then 3 kilometers, walk and jog, then run 3 kilometers, then run 5 kilometers. Even not even kilometers, think about minutes. 20 to 30 minutes.
Correct.
Oh, yeah, I'm pain free. It's not about how much distance you cover, but I'm able to run pain free for 30 minutes.
Mm-hmm. Yeah, I think, yeah. Go ahead, sir. Sorry, I think you got a call or something.
Am I audible?
Yes, sir. Yes, I think you got a call. No
Yeah,
problem. Yeah, go ahead, sir. Yeah,
yeah,
I think
yeah.
more in terms of duration.
Slowly get
Go ahead. Yeah, I think now we can hear you. You're good.
into the sport. Run longer, plan your calendar efficiently, speak to your coach, always communicate, don't hide your aches and pains. It's very
True.
important.
So another question, generally, I think this is something I really wanted to ask. So when you have IT band, it's something somewhere on the pocket where the hip is connected, right? So a lot of people to maintain the fitness. I'll take another 5-10 minutes, sir. I think
Please,
before
please,
we wrap.
please, please. No.
Yeah. So a lot of people to maintain fitness, they go cycling. So cycling is a sport where you're sitting. And
Yeah,
generally sitting, right, creates a lot of stress on the hips. Now, if you're IT band, now there are two other things that you can do. Generally, like three other things: stair climber, elliptical, and cycling. All right. So, which is a better alternative when you're not able to run for 2 to 3 weeks? Which one would you recommend an athlete to do?
very nice. Very nice question, Shreyas. Uh, IT band gets irritated for cyclists and runners.
Yeah,
Okay.
yeah.
So, why? Because cycling to be in that aerodynamic position, the knee keeps collapsing inward. You know? That's why
Mm-hmm.
cyclists get it.
Get
Now,
it.
when it comes to cardio, you either in the acute phase, if you know swimming, go and swim.
Swim.
Okay.
Okay.
Yeah. If you can walk, you can walk.
Walk. Yeah.
Okay. When it comes to cycling, always play with the angle, the way
Okay.
you
Keep a
the
higher
sit on the
angle.
saddle. Yeah.
Ah,
The
got
way
it.
you sit on the saddle. Okay.
Mm-hmm.
Because in cycling, 3 points play a very important role.
True.
The way
True.
you sit on the seat, the placement of the foot on the pedal, and the handlebar. Okay,
Mm-hmm.
so that plays a very key role. You need to adjust that and ensure that you sit a little higher, and
Okay.
then
So
you can
that it
cycle.
doesn't get
Yeah,
crammed up.
yeah. The idea is to do all movements in the pain-free range or zone.
Bench. Mm-hmm.
In
So you think
ITB,
rest is not a solution?
no, 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 no chance,
You
no
can continue
chance.
to train. Yeah.
Yeah, yeah,
Elliptical
hundred
also is
percent.
fine, sir. Elliptical and rowing.
Elliptical mimics that 20 to 30 degree of knee flexion. Uh,
Oh, okay.
so yeah,
Ah,
so
okay.
if it's not hurting, it's okay. So
Mhm.
basically, idea is to first get into non-impact sport and then impact, which is running.
Running, yeah. Now we also have skiing.
Ski erg,
I'm
ski
seeing a lot
erg,
of people saying skiing. Yeah.
rowing as well.
Right,
Ski erg
yeah,
and
that's what I
rowing.
was saying.
Yeah,
I mean, it's amazing, right? We're so privileged to be in such a world. There is some other way to keep yourself fit. Skiing is very difficult. It's not easy.
very difficult. It's not easy.
Very difficult. And
Yeah,
I've seen
yeah.
you make people do single leg skiing. I tried
Yes,
once.
yes.
My
Yeah,
heart rate was going like 160, 170. I
yeah,
think.
yeah.
Yeah, I think that's great. So now going back, just to connect the dots. Now, as a physiotherapist and as a leader in your workspace where you're training thousands of athletes and train many more across spheres, not only runners. You train footballers, tennis players, and day-to-day people also with chronic pain and all that. So now you got into running. Okay, now over the last 2 to 3 years, I think you're the one of the very few physios. One of the reasons why I really appreciate you is because you're not someone who's just sitting on the table and dictating terms. Okay, for the last 2 to 3 years, you're running different courses. Now, from being a physio and a strength coach, I call you both because I think both complement each other. Now you got into running and you're going to run Berlin in like 7-8 weeks. Now, how are you seeing the sport from a runner's angle compared to what you were seeing the sport maybe 4 years ago?
Yeah. Again, very good question, Shreyas. Um, See, the reason why I wanted to do a lot of research in running is because every sport requires running, every
Mm.
sport. And when it comes to marathon running, it's all the repetitive force, as I mentioned earlier.
Mm-hmm.
Most of the time, as I said, we do it for experience,
Yeah.
for the love of the sport, the joy
Mm-hmm.
that it gives you. It de stresses you.
Mm-hmm.
So, uh, all the other priorities, you know your priorities. So, that is number one. And
Mm-hmm.
find time. and work towards it. And at the end, it's all about how much you can do. It's not about competing, climbing the ladder, understand the situation, circumstances, and based on that, you continue to train. Again, I said discipline becomes very important when it comes to running. You don't require a lot of skill. You have to run every day.
You have to
I
run
mean,
every day.
yeah, yeah. So
Yeah.
how do you recover? If you're not recovering, it's okay to take a break. Okay. So listen to your body, as I say, and then you continue to plan your calendar and work towards it. The injuries which were there before, for example, we when I started, PFPS was, almost
For
everybody
example,
had.
PFP, if you can just say what it is, it's
Yeah,
the knee pain.
it's a patellofemoral pain syndrome, knee pain with what we call it as anterior knee pain. Basically, the cartilage under the patella wears out, the stress. That's why we get pain. And we used to see that more often around 7 6 7 years back. Right now, we are getting to see people are more educated, learned, aware. Everybody does strength training, so the stress around the patella has come down considerably.
Yeah, true.
But injuries like stress reactions, stress fractures, tendinopathies, or the tendon
A
injuries have increased multifolds.
lot on the foot, sir. A lot of people are complaining around the
Yeah,
foot.
yeah, yeah. Foot is the first point of contact. No, we
Achilles
need to.
tendon.
Yes, we
Yes.
yeah, we have to work on the foot. I always tell you, pamper your foot as well.
Yeah,
Keep
yeah.
because it's very very important as runners. Um, uh, Calf endurance plays a very important role. If you're unable to do for a 35-year-old, single leg calf raise is minimum 30 to 35. That's
Okay.
the test.
It's a test.
Standing, one finger support, you should be
Mm.
able to touch the heel should be touching the floor, and you need to raise the heel as high as possible.
So, yeah.
35 times is the benchmark for a runner, for anybody, for an amateur runner.
Amateur runner,
So
yeah.
compare the right versus the left. If one side is lesser as compared to the other, then
Mm-hmm.
you are more prone to stress on that injury on that side. Second is the hip abduction test, where you wear the band around the ankle or the front part of the foot, lie down sideways, raise your leg up, okay, and compare in 1 minute how many you can do on the right side and how many can you do on the left side. So these are parameters to ensure that you are in the right path. Do the single leg hop test. Just hop standing in one foot. Understand, is there any stress reaction in the body? If there is any stress reaction in the kinetic chain, you'll start developing pain on the on the shin area, around the hip area, around the knee area. So these are very simple, basic, you
Let's
know,
see.
movements and tests that would really determine your
Yeah.
day-to-day activity. Should I push myself today?
Mm-hmm.
You need to do these three: single
Got
leg, do the calf endurance, do the hip endurance test, and you will get to know. Single leg hop, you'll get to
yeah.
know, oh, no, I have stress today. My left side
Yeah.
is
So you
very,
get to know, you get the shock.
yeah, 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 yeah.
Yeah, yeah.
So,
So I think I think there's a lot of awareness that needs to be created in a very structured way, because a lot of
yeah.
people are getting the sport. And I'll also be very candid and honest. So when we got into the sport, we started very slow. We took years to get there. So today, right? A lot of us, there is this Instagram, there is this, marathon that's happening. People are trying to get to a certain level with a very short frame of mind. Okay. And I, as a coach, I also feel very helpless at times because, that's how human nature is. Now, can you speed, track strength, or you think that it should take its own course of time? People
Can
say,
you
I'm okay to do 5 days of strength. People say, I will do 5 days a week strength, but I want to do this. I said, it doesn't work that way.
Shreyas, again, planning the calendar is very important.
Very important.
So that
Okay.
is why sitting with the coach, understand where you stand today in terms of running, how much distance you need to cover, so your goals has to be very realistic. We always speak about the SMART principle: specific, measurable, achievable, realistic, and time bound. Right. So
Correct.
that
Yeah.
that 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 principle comes into picture here. So the runner, if you want to run, how many hours of training in a week you require to hit a 5 hour
Mm.
benchmark. And it
Benchmark.
happens over a time. It
Mm-hmm.
doesn't happen in 3 months, 6 months, because all of us built in a different way, as I mentioned.
Different way, yeah. Yeah.
Our history of exercise and movement plays a very important role.
Mm-hmm.
What did you do when you were in school, in college? Did you actively involve in a sport or not?
Mm-hmm.
Have you regularly been doing exercises, strength training? So all these questions, history determines, your duration in running as a sport. See,
Nice. Okay. Interesting.
running is a normal movement pattern of the body. We all of us should run because the benefits outweigh risks. Okay.
Absolutely. Yeah, there's some element of risk always. Yeah.
Yes. So we need to know how much is too much. It's not always pushing through mind. The body
Mm-hmm.
is there at the end.
What is it at the end?
Yeah.
Right?
So you have
True.
to create a balance between the mind and the body.
Mm-hmm.
Extremely important. So that happens only when you slowly train, appreciating, respecting, listening to your body rather
Mm-hmm.
than pushing through pain. Remember, we amateur runners were doing it for passion. So that is the reason why you sit with your coach and understand why, and why is he saying that you will take a year to run a marathon,
Mm-hmm.
or you'll take couple of years to run a marathon. Do
Yeah.
these, follow the processes first.
Yeah.
First,
Yeah.
uh, follow the parameters that support running. For
Mm.
example, strength. Yeah, for example, your sleep, which your
Mm.
recovery system, your strength system. Everything should revolve around supporting your running. Running is
Right.
the
Yeah.
primary goal.
Yeah. Yeah. No,
What
100%.
happens is what happens is this: the other parameters overpower running.
Mm-hmm. Mm-hmm.
That's where we miss out on, because as I say, that running is an impact sport,
Impact
right?
sport. Yeah. Yeah.
And it's very important for us to manage the entire week load. So
Correct.
that's why we always discuss shares that it's not about the exercise; it's about what exercise when you need to do.
What exercise you need to do? Yeah. True. I agree. Yeah.
Yeah.
No, I think there's a lot of I think one side there's a lot of awareness, but unfortunately the bridge is still only getting bigger and bigger because a lot of people are getting into sport.
Yeah.
So one last question before I leave you. So as a person, you already run a marathon. Okay. I
Couple.
only not see you as a physiotherapist. I also see you as a performance specialist. I also see you as a strength coach. Off late. I see you more as a strength coach now. Because the way you heal things with strength, that's phenomenal. Now if you look at how running is growing, okay, now your vision and mission, let's say as a performance specialist, if you have to tell people, I know you cannot work with everyone, right? And the company is so big, but if you have to tell people a few, probably three tips how to ensure that, I think everybody will get injured at some point of time. Some it'll happen, overload or
Yeah. So
something will happen.
some niggles will be there
Some
over
will
a
be
period of
there,
time.
some
It's a
aches
part
and
and
pains,
parcel.
right? It's a
Yeah.
part and parcel. But you have to say that you have to give from a physiotherapist as a strength coach, you have to give them three things to minimize injury risk and to run for long. What would it be?
Yeah. Number one is get yourself assessed. Okay. It is the first step towards injury prevention. When I say get yourself assessed, both in terms of your blood parameters, that includes everything, your ECG, echo, TMT, etc., and also get a musculoskeletal assessment done, which
And who can
is
do a musculoskeletal assessment? It's a
it's always, since it's a sport, it's better to meet a sports physiotherapist.
sports
Okay,
therapist.
so that he can give you a better insight towards movement screening, the difference between the right side and left side of your body, your running biomechanics. How do you strike? Basically, the striking pattern is not the problem, but based on the striking pattern, we need to empower you. So, what exercises you need to do to get better? Because
Got
many runners are worried about overpronation. Many runners are
Yeah,
worried about many other factors.
yeah.
But Gabriel Selassie was a overpronated runner.
Oh, yeah.
Okay,
His arm
so
didn't even move properly.
yeah, and he won many medals for the country. So that's how we need
27 world
to.
records. Yeah.
Yes. So we need to work towards targeted muscle groups that really helps you get better and absorb the load when you run.
Okay.
So
So
that's number
point
one.
one, point two. Yeah.
Point two. Point two is understand more than how much you load, understand your recovery pattern. Okay. Your day to day load, have a coach, speak to the coach, set your priorities right, and make your goals very realistic. And
Mm-hmm.
third and last, as you continue the process, don't get carried away. Always set goals what you want to do.
Yeah. Yeah.
Don't look at others. You are a different human being altogether.
Yeah.
Work on your or you getting better every time
True.
rather
Very
than
true. Yeah, great, sir. I think it's been last awesome 40 45 minutes. Not take much time. And sir, I think we should do more of this in a very more packaged way because I generally feel I've learned a lot from you the last 8 9 years.
thank you,
And
Shreyas.
I definitely feel
Feeling
that
mutual.
when I speak to runners from other people, right, from other places, I wish that they could have you could clone we could clone you and send it to them. It's just not about treating. It's just about making them aware. It's just not about
Yeah,
okay, you come, you do a release, you give them 10 exercises, they don't come. It's about making them aware. I think I think hopefully looking forward for you and your team to create more awareness about various injuries and how to prevent them, and even if it happens, how to overcome them in a very scientific way so that they don't recur again.
right.
So thanks to you and the team for doing a fantastic job. I always tell people if you meet Somya Rout, dig a lot into him. He's got a lot of knowledge. Okay, I don't know how much you can give to people, but I've been very fortunate to have access to that, and I really hope and wish that you can do a lot more. I mean, it's a deep-hearted wish. I think because the community will get benefited. So with that, sir, thank you so much for your time on a Sunday
Thank you,
evening.
Shreyas. Thank you so
I
much.
hope everyone enjoyed, and hope we'll do much more in a more structured way in coming times.
Surely. Thank you so much. Thank you,
Thank you,
Shreyas.
sir. Take care. Have a great evening, sir.
You too.
Thanks,
Bye.
everyone. Thank you.
Bye.
Bye.